about dental amalgam facts. So here's a great quote, and I don't know who said it, but it's very common.
Yes,
You
very
don't
common.
have to brush your teeth, just the ones you want to keep. It's kind of a funny one, but it's so true.
To a degree, yeah.
Yeah. The U.S. National Library of Medicine says that dental amalgam has been used in dentistry for about 150 years.
Mm-hmm.
That's a long time.
That is a long time. Wow.
So there's been a lot of negative talk about amalgam fillings because of the fear of mercury poisoning. Do you have any comment on that? Do people still talk about that?
There is always going to be that. In Europe, I know they try or they don't use amalgam fillings. Part of it is because of the waste that gets put into the water system. But there are so many things out there that people get concerned about: fluoride, plastics. Like 20 years ago, I didn't know what BPA was, right? So as we do more and more research, we try and figure out what is safe, what is acceptable. Okay, so there's an acceptable level of things, right? You eat tuna. Tuna has mercury.
Right.
So they say don't eat too much tuna in a day. So there are various facts and advice that people give, but you hear so many things. I've been trying to do different diets and like, oh yeah, you shouldn't eat tomatoes because tomatoes do this to you. You shouldn't eat cashews because cashews can do this. I hear so many things. So I tell people in moderation, and we try and do what we can in the safest level that we can.
Okay. So what is dental amalgam exactly?
So dental amalgam is basically a combination. It's a metal. Obviously, the main ingredient is mercury, but there are other metals such as like copper, tin, platinum, palladium, iron that blend. Okay, and so amalgam is an alloy. Okay, it's a mixture. It's like stainless steel.
Okay.
Stainless steel is a bunch of different metals that get heated and kind of formed together, okay, and melted together, and that's what makes the property, the strength to prevent from rusting or corrosion, other stuff, right?
Bacteria.
So that's what we have amalgam, and that's what we use sometimes to restore dental cavities.
Okay. So why is amalgam used then for filling material?
Well, and before, when we didn't know about what white fillings, I heard that white fillings and the bonding for white fillings was actually from like an accident from NASA. They were trying to develop certain things trying to fix things on the spaceships, from what I heard. And they developed this product that can bond to teeth. So it worked out well. But before that, we had amalgams, and that was the main treatment of choice. There was no other treatment to fix a cavity, so when you had holes, you either pulled the teeth out or you tried to fix them.
Okay. So is it deemed to be safe by the Canadian Dental Association?
Yes, I will say yes. The Canadian Dental Association, the Alberta Dental Association, and the Tooth Doctor, we all feel that there has been enough research to say that dental amalgams are within safety limits. Okay, if they're FDA approved, why would they allow it, right? But again, everybody has different degrees of safety, right? We allow for, genetically modified tomatoes. We still eat them. Are they safe? That's for each person to differ, right?
Right. So haven't studies shown that mercury is released from dental amalgam and it shouldn't be used?
They have studies. I remember reading an article about people's brain function and their ability to think and all that stuff. The difference was very insignificant. And you're gonna get some people where yes, they do get affected. I've heard stories. Patient gets like 15, 20 amalgam fillings taken out, put in white fillings, and they're feeling so much better. They feel like they can breathe better. They're healthier. So I can't say for every situation, but I still do use amalgam because I feel that it is still a good, safe product, and there are pros to having amalgam as opposed to white fillings, right?
Right. So isn't mercury a poisonous substance?
Yes. Mercury itself is poison if ingested, right?
Right.
That's like, hey, let's take some chlorine and ingest it. So, but we still go to swimming pools where they use chlorine to kill the bacteria in the water. But if your kid goes in and drinks some chlorinated water, is that dangerous? Do you not let your kids go swimming in swimming pools? You know what? Again, everybody tries to find the problems with issues, but again, there's enough research and studies to understand that amalgam, mercury in itself is not safe, but the amalgam that we use is a combination where it's mercury and metal powder that blends together and makes a product that is solid.
Okay. Is there a health danger to most people with amalgam fillings?
I can't say.
Yeah. Okay.
You know, everybody, people. I remember in dental school, I met this elderly lady. She had these amalgams for 40 years. They're great. She kept all her teeth. She didn't have to wear dentures. You know, I was like, yeah. She's like, I'd rather have these teeth than have to wear dentures. So there are some pros to having fillings done, and they last for a long time.
Right. Quality. Mm-hmm. Is dental amalgam safe to use with every patient?
I try to use white fillings, composite fillings on most part, because most people want to have nice white teeth.
Mm-hmm.
You know, they think it looks better, right? And it's just kind of part of the times. But on the rare occasion where it's difficult to get bleeding to stop or saliva control, in order to use a white filling, you have to have proper isolation. Can't have any wetness. So saliva, things like that. So there are going to be situations where it's too difficult. Now, some patients I will say, hey, you can put a silver filling on there, an amalgam filling, or we could look at putting a crown on there. Well, not everybody can afford a crown. Not everybody, wants to just pull their tooth out, right? So we do what we feel makes the most sense from a longevity and a cost standpoint. All those things that play factors in terms of what we're trying to do.
Okay. Why does it hurt when another metal like aluminum touches an amalgam filling?
Well, if you take two metals together and you actually slap them together, there is something called a galvanic shock, where different atoms and ions from the two different metals, as they tap, they kind of pass through each other, and that's where this current, in a sense, happens, and people get this tasting of metal, or this kind of shock sensation when they accidentally bite into something. And I've never personally experienced it myself, but we have understood it from dental school, where it's like, oh, if you have a crown on top and a silver filling on the bottom and the person keeps biting on them, there is always a possible risk of that happening.
Right. Should someone with amalgam fillings get them replaced with other materials?
Small little quote: if it ain't broken, why fix it?
Good quote.
Okay.
Yeah.
I had a staff member once. She had one little silver filling on her tooth, and she's like, "Oh yeah, I want all my teeth to be nice and white. So this kind of bugs me. Can you change it, doctor?" I was like, "Sure. If you want to change, let's do it." So I replaced her filling, put a nice white filling, and everything looked good. Filling wasn't too bad. She came back and it was bothering her. Long story short, okay, just by changing the filling, caused some trauma to her tooth, which ended up causing a root canal. So she needed a root canal, and then she needed a crown. Okay? So whenever I replace fillings, I always ask myself the pro. What is the benefit of replacing it? Is it making the person sick? Is it necessary? A lot of times it's what the patient requests. But I wouldn't routinely come to you and say, oh, a bunch of silver fillings. Let's replace them with white ones. It'll be better. They will do better. That's not true, and that's not the case. I don't want to sound rude, but I'm going to be blunt that I personally feel it's a money grab, because I would never do that to my parents, my sister, my wife, my kids. If they have a filling and it's doing okay, then it's okay.
Yeah. That's a good attitude. Do you still use amalgam then to fill teeth? You kind of already answered this.
Yes.
Yeah, you do.
I still do. On the rare occasion we have patients where, let's say it's a root canal tooth and we put a silver filling in, because the silver filling is stronger than a white filling, and then later on if we decide to put a crown on it. So that's an example. We've had some patients where they have these very deep cavities, and I'm going to try and fix it. I don't want to pull the tooth out. I tell my patients, my goal is to save as many teeth as possible for as long as possible, for as cheap as possible.
Yeah.
Okay, so we want to put silver fillings if it's gonna last long. If I feel that this is gonna last a certain amount of time, maybe it buys you 3 or 4 years, and then you can save up and get a crown or something like that. That'll be a better long-term restoration. But yes, we do use amalgams because we do feel that at certain points in time it is necessary. And here at the Tooth Doctor, we do want to care for our patients in I feel the best way possible. And I think that just doing white fillings all the time, there are some concerns with white fillings too. Again, is it a cause for fear? It's a certain limits and certain issues. There are certain, I guess you could say, they are white fillings and silver fillings. There are certain standards that have become acceptable by the Canadian Dental Association and the Upper Dental Association.
Great. Well, thank you very much for answering some of those, very actually interesting amalgam facts. And thanks for joining us here at the Tooth Doctor YouTube channel here in Edmonton. And don't forget to subscribe to the channel, like the video, leave us a comment or two on what you've learned, what you want to know more about, and we'll get back to you. Bye.